Thank you for tuning in to the Into the Classroom series produced by Mental Health California, sponsored by Blue Shield of California's Blue Sky Initiative.
Welcome to Into the Classroom, which is a student mental health awareness multimedia series produced by Mental Health California. I'm your host, Conrad Crump, affectionately known as Coach Crump, and for today's topic, we're going to talk about mental health conditions. Now, college life is an exciting and transformative period, but it can also bring about unique challenges and stressors that can impact mental health. It is essential for college students to have a comprehensive understanding of mental health conditions, their effects, and how to address them. Today, we'll put this conversation together about mental health conditions right on the table in an effort to reduce stigma. We'll also provide college students with the knowledge and resources they need to prioritize their own mental well-being. With us today, I'd like to introduce our clinician, Ali Garza, who is a licensed clinical social worker on faculty with the Department of Psychiatry at the University of Colorado. She has expertise in youth suicide prevention, crisis intervention, supporting parents and families, and treating OCD and anxiety-related disorders. Hi there, Ali. How are you?
Doing pretty good. Thanks for having me again.
Wonderful. We also have with us some youth guests. Today, I'd like to introduce Keyshawn Williams, who is a recent graduate of Sacramento State University. What's up, Keyshawn?
How you doing, Coach? Good to
I'm
see you.
doing good. Good to see you too. We also have with us Nicholas Crawford from Hampton University. Hey there, welcome, Nick.
Hey, how's it going?
Doing pretty good. All right. We also have with us Monica Tamayo from the University of California at Los Angeles. Hey there, Monica.
Hello, thank you for having me.
Yes. And last but certainly not least, we have with us Joel Suazo from Los Angeles City College. What's up, Joel?
What's up, everybody?
Good. So now that we're all here, I'd like to get into this conversation, but before we do, I'd like to turn it over to Ali to get some brief clinical insights into how we might be able to recognize common mental health conditions and what treatments are available to college students. Ali?
Yeah, absolutely. So, in the DSM, which is basically the diagnostic manual with every sort of mental illness that we're looking for as clinicians, there are a bunch of different categories. I would say for college students, the disorders that we see the most fall under either the anxiety related disorders, the depressive related disorders, and then sometimes under bipolar related disorders or OCD and related disorders. As far as what to be on the lookout for, I think the biggest things are level of impairment. So, when someone wants to get connected to services, that's kind of the first question that we want to ask as clinicians is what's happening? What are the symptoms that you're experiencing? And how is it getting in the way of you doing what you want to be doing with your life or how your day to day kind of goes or what gets in the way? So, those are the things as far as like looking for maybe the signs of is the people in our life that are struggling, are they withdrawing? Or like engaging in more self-isolating behaviors, or maybe are they acting in ways that wouldn't typically be the way that they would present or move through the world, or maybe are they overperforming, like are they really going out of their way to doing these things to basically make a point or like really prove their worth. So these are some of the things that we'll be on the lookout for, along with how is it impacting them when making a mental health diagnosis.
Wow, very good. Thanks a lot for that breakdown there, Ali. That's super helpful. Right now I'd like to ask some of our youth, get some of our youth participants in here, just by a show of hands, can folks here that are on this, screen right now, just by a show of hands, talk to me or tell me if you yourself have dealt with a mental health condition or if you know someone that is dealing with a mental health condition? Wow, I see a lot of hands going up. So clearly, I'm not alone. They're not alone either. So let's go ahead and get into our slide presentation to discuss more on mental health conditions. Now, we know that mental health is a crucial aspect of overall well-being, especially for college students. Especially for college students who are navigating, you know, academic pressure, different challenges, as well as personal growth. There's actually a number of studies that have been done, but according to a survey conducted by the American College Health Association, in 2019, over 60% of college students reported feeling overwhelming anxiety, and over 11% reported having been diagnosed or treated for an anxiety disorder in the past year. This shows a lack of actual treatment, among students. So it's important that we talk about this. Let's go ahead and move on to our next slide. Now, again, a number of studies have been conducted, and the National Alliance on Mental Illness, or NAMI, has reported that suicide is the second leading cause of death among college students in the United States. Approximately 1,100 college students die by suicide each year. Another study called the Healthy Mind Study, which was a national study of college students on mental health, found that over 17% of college students reported seriously considering suicide in the past year. Additionally, nearly 36% reported feeling so depressed that it was difficult for them to function. Let's go to our next slide. So when we talk about common mental health conditions, we've got anxiety disorders, such as a generalized anxiety disorder, social anxiety disorder, and panic disorder. It's characterized by excessive worry, fear, and physical symptoms like rapid heartbeat and shortness of breath. Also, depression. Depression is a mood disorder that affects one's thoughts, feelings, sleep patterns, and daily functioning. Symptoms may include persistent sadness, loss of interest, changes in appetite, and difficulty concentrating. Let's move on to our next slide. And other conditions exist as well. This includes bipolar disorder, which involves extreme mood swings, ranging from manic episodes, which can include elevated moods or increased energy, to depressive episodes, which can include low mood or loss of interest. We also have other disorders, such as eating disorders, such as anorexia and bulimia. And these are serious conditions that can affect one's relationship with food, with body image, which can have severe physical and psychological consequences as well. Let's move on to our next slide. Now, another mental health condition that, often doesn't get talked about includes substance use. And this can include alcohol and drug misuse. And it's a significant concern among college students. Prevention programs and counseling services and support groups can all help to address substance use issues. Now, let's go on to our next slide. We talk about treatment. So for depression and bipolar disorder, treatment might look like therapy, medication, lifestyle changes like regular exercise and maintaining a healthy support system. And when we look at anxiety disorders, some of those solutions might look like evidence-based solutions, which include cognitive behavioral therapy, or CBT, medication, as well as self-care practices like mindfulness and stress management techniques. So I'd like to turn it over to you, Ali, if you can talk to us a little bit more about some of the treatment that might be available for young folks.
Yeah, absolutely. I would say one of the greatest challenges, especially for younger folks, is just getting them connected to evidence-based care through an accurate diagnosis. So I would say, for example, with the last slide, how we treat bipolar can be very different than how we treat depression. There's different things as far as medication interventions that are going to be changed based on the diagnosis. So getting a thorough assessment so that you can get connected with the accurate evidence-based care. From there, I think CBT was one of the things that it noted on that slide, and that's absolutely the route that I would go for most anxiety-related disorders. But even under that CBT umbrella, there's even more interventions. So for example, one is ACT, which stands for Acceptance and Commitment Therapy. I integrate that into a lot of the work I do with people who have anxiety-related disorders and OCD-related disorders. And then one that, for example, if someone's struggling with impulsivity or emotional regulation challenges, which sometimes can go hand in hand with bipolar disorder, then integrating DBT, dialectical behavioral therapy, can be super effective as well. So I would say starting with getting to a clinician that has expertise or training in what you think might be going on, and starting with a diagnosis can be one of the biggest hurdles and set you on the best path to like healing and being able to manage whatever the diagnosis may be.
Yeah, no, that's very good. Thank you for that. I mean, there are a host of different approaches for a host of different disorders or conditions. So, really appreciate you bringing that analysis and helping us to kind of sift through some of that, because it can be challenging for young folks as well as for family members who might be in our audience listening today. All of these different types of treatment can be, beneficial as we go along our journey to wellness. So let's go ahead and move on to our next slide. So some of the other types of treatment for eating disorders, also can include a multidisciplinary approach, which can include therapy, nutritional counseling, as well as medical monitoring. And when it comes to substance use, prevention programs, counseling services, as well as support groups and peer support can also help to address substance use issues as well. So let's move on to our next slide. Looking at having open conversations for stigma reduction. We definitely want to increase awareness so students can attend mental health workshops, seminars, or even guest speaker events. We want to avoid stigmatizing terms, that might use person-first language that emphasizes the individual rather than the condition. Additionally, we want to open up about our own experiences with mental health, and that can also help to reduce stigma and encourage others to seek help as well as come forward with their own stories. So I kind of want to open it up to some of our young folks and think about reducing stigma. And I wanted to ask you, let's go with you, Monica. Like, when it comes to having open conversations about reducing stigma, why might that be important for someone that's in college?
Yeah, I think it's really important to talk about it because there are some people that might feel like that they can't go out there and get the help if they feel that they're going to be judged, maybe just like turned down or get their symptoms dismissed. So I feel like when we talk about it, it's very important. It gets people hopeful. They're able to get that confidence that they need to go out and get that help that they need to also assist them in that. But yeah, I think overall it's just when people talk about it, people are less scared to ask for help.
Very good. Thanks for that. How about you, Keyshawn? Any thoughts on stigma reduction?
I think it's super important to talk about conditions because, especially when you're young, you feel like it's not okay to be different or to feel different than other people. So, in order to talk about it and to normalize it, um, that would help other young people feel like, okay, there's nothing broken with me or there's nothing wrong with me. This is something that we all go through, and this is something that I can get help for, and it doesn't make me a weaker person or a lesser person or a different person. So I think it is really important to talk about it as much as you can. And even when you're talking about it, someone else might not admit it, but they might listen to it and go back to their safe space and think about it a little bit more because you were open with it yourself.
Yeah, no, that's so true. That actually brought a thought in my head. Thanks for that, by the way. That brought a thought in my head. You know, me personally, I've been on a sobriety journey, and so I've been very public about it as well. Oftentimes on my social media, I'll put different things out there about, hey, this is day whatever, whatever, and talk about how I'm feeling, or just, just basically what my day is like. But I'll also make a note of it being a sober day, and I can't tell you how many people have DM'd me, inboxed me, texted me, basically saying thank you for being open and being really transparent, because it's helping them along their journey and helping them to like consider making some lifestyle changes as well. So it's so true. Like when you're able to talk about it and reduce the stigma, there are a lot of other people that are really thinking the same things that you're thinking as well. So very good for bringing that up. Let's go ahead and move on to our next slide. So culturally appropriate support for diverse students. So when we talk about students of color, we know that they often face many unique challenges due to cultural factors as well as systemic inequalities. There are holistic remedies such as culturally sensitive therapy, as well as support groups and healing circles that can help to provide a more suitable option for students of color. So let's go ahead and move on to our next slide. We talk about on campus, right? So campus mental health conversation. So colleges can create a culture of open dialogue by organizing mental health awareness campaigns, by hosting guest speakers and incorporating mental health topics into the curriculum. By encouraging student-led initiatives and providing platforms for sharing personal stories, this can all help to foster a supportive environment for students. Let's go ahead and move on to our next slide. So there are a couple of organizations, well, there are many organizations that are providing support, but a couple we'll list today. The Active Minds. This empowers students to speak openly about mental health and provides resources for mental health advocacy on college campuses. Another group, NAMI, which was mentioned earlier, National Alliance on Mental Illness. They provide information, support, and resources for individual and families affected by mental health conditions. And then we also have SAMHSA, which is the Substance Abuse and Mental Health Services Administration. They offer helpline, treatment locator, and educational materials on mental health and substance use. So let's move on to our next slide. So addressing mental health conditions. Now, students who think they may be experiencing a mental health condition should reach out to their college's counseling center or into a community health professional or community health center as soon as they start to feel this way. Many colleges offer counseling services, support groups, and workshops that are focused on mental health. So I definitely want to encourage students, take advantage of these resources so that you can gain support and also learn from coping strategies. And next slide. And engage in activities that promote well-being, such as exercise, making sure you get enough rest, eating a balanced diet, as well as engaging in hobbies. By prioritizing self-care, it will definitely help to manage your stress and improve your mental health. Also friendships, right? Being in your social groups, visiting with your family, visiting with your friends or mentors. All of these have a benefit of being able to help you develop as well as share your experiences with folks that you feel that you can trust, that can help to provide that comfort and encouragement for you. So I want to ask our young folks on the call today, some of the folks I haven't heard from. Joel, like when we talk about, addressing mental health conditions, can you talk to me about like the benefit of having friends or support groups on your journey?
Yeah, so in mental health, I think it's very important to have, friends that are have the same mentality of you. I noticed when I was in like high school, I was hanging around, some of the people that weren't really good for me or had the best interest for me. So, as I grew older and, went through life experiences, I learned that, those are not the type of people that I want to be around. And overall, like I think it's good for you to have a supportive friend group or family members, or even just your peers, coworkers, people that can provide insight on, making better choices in life, and overall, going outside to exercise, reading, recharging your brain, recharging your body, and overall just, practicing those good coping mechanisms and good life skills.
Yeah, I appreciate that, Joel. All of those definitely can help, a person along their journey. And let me ask you, Nicholas, when it comes to self-care, right? Like self-care, what are some self-care tips that you might practice or that you could recommend to a young person that is, trying to focus on their mental wellness?
Sure. I think a major thing that's helped me as far as like self-care and self-love goes is the gym. I say exercising and whatnot. It really helps improve like your self-image, and it's just a very positive, uplifting experience. And I think that a lot of people, they have a lot of like negative thoughts about themselves because they don't actively like work on themselves, or try and improve their current like physique and whatnot. And I found that going to the gym and seeing results, helps helps me stay in a positive mental attitude. So I think
Very
that's a
good.
good form of
Yeah,
self
no,
care.
very good. Thanks a lot for that, Nick. Certainly helps with that, seeing yourself in the mirror and you start to see some changes, even though they might be little, it takes some time, but it's definitely something you notice and it makes you feel good. So that's very good. As I'm sitting here, I'm looking on the call. I've got someone from the community college system, I got someone from the CSU system, I got someone from the UC, and I also got someone from an HBCU. I mean, I think this is awesome. We've got the whole spectrum. So I'm curious to know about what's going on at your school in terms of resources or mental health support for students. So I'll kick it off with you, Keyshawn. Talk to us about what's going on at Sac State. What support and services might they provide?
The biggest thing at Sac State that I saw was peer counseling. I think that that's always a great thing at any campus, and we've talked about in previous podcasting how good peer counseling is, especially for people our age. And I know at Sac State, a thing that stuck in my head is every semester they would have the peer counselors set up in the main library quad, and they would offer pamphlets and they would talk to people and reach out to people about, hey, if you need help, we're here for you. And that always stuck out in my head, and I always started to mention that to other people who I felt like were having problems within their lives. So I would highlight that, the peer counseling at Sac State. That's been really great.
Okay, so we got some peer counseling there. Okay. All right, Joel, talk to me about LA City College. What's that look like for someone who might be going there in the fall?
Yeah, so at my school they started to send out emails where they have Zoom links, whether to people who can't come into class or don't attend school on campus. So they had one, I think it was today, they sent it out. It was like Mindfulness Monday. You join the call, it's about 30 minutes, and you sit around with like-minded individuals, other students, and a facilitator who just overall practices mindfulness, those exercises and good coping mechanisms. They also have a therapist on site. If you need to speak to someone, you can speak to, someone who is certified and can either diagnose what you have going on or give you better tips on how to deal with those situations. And for the most part, yeah, that's kind of the basis of everything that they have for all the students.
Cool, man. That's really cool. I appreciate your feedback and I appreciate that. I didn't think about that, but yeah, I think that's pretty awesome for folks to have a link that they can join, regardless of wherever they are, to just jump right into a room and just kind of get the boost that they might need. So that's really cool. All right, Monica, talk to me about UCLA. What does support look like for students seeking mental health and wellness?
Yeah, so here we have something called CAPS, the Counseling and Psychological Services. They also offer peer counseling. There's group counseling, the one-on-one therapy as well if needed. They've also started to promote an online resource. It's called Togetherall, and it's an app that you can download. I believe it's free for anybody. You register with your UC email, and then you can talk anonymously to other people that are going through what you're going through, and that way it's like
Mm.
it's a judge-free zone. You can just pour out your feelings or whatever your thoughts are, get that feedback, that quick feedback if you need it. But if you need something more specific to you, there is that one-on-one therapy that's offered.
That's cool. So one-on-one therapy, and then you've got the app, the power of having it right in your own hand. So that's awesome. Thank you for that. And Nick, talk to us about what goes on at Hampton. Being able to have access to mental health is certainly important for Black students. So can you maybe talk to us about what that might look like?
For sure. I think, yeah, like in today's like day and age, mental health is definitely becoming more of a trending topic. So it's getting more attention. And they opened up some like wellness pods on campus where I guess people can like come and chat with each other. I don't know. They had like a whole mental health like week and push and everything. So it's definitely become like an important topic, around campus. And they have free therapy for people if you need like one-on-one counseling for specific issues. So they're definitely, yeah, doing their part to, help the mental health of students.
Yeah, no, that sounds really good, man. I appreciate that. So it sounds like, they've got a campaign going, something on campus to raise that awareness amongst their students, as well as a space where students can go and physically drop in. So I think that's really cool. So that's good to know. So folks in the audience, who may be considering attending an HBCU, just know that at Hampton University, they've got some good stuff. So I want to go to our clinician, Allie. As we talk about all of these different types of resources and support, I'm curious to know, can you maybe talk to us about other mental health resources outside of the school that students might be able to access?
Yeah, absolutely. Actually, when Monica was speaking, I was like, wait, UCLA, it actually has like a robust OCD program and that I've heard great things about. And I've heard about this program called Peers. I think it just highlights that there's like, while access to care is absolutely a challenge, there also are so many resources out there that the system can just be really challenging to navigate and to find it, right? If you Google depression Los Angeles, there's just going to be thousands and thousands of pages. And so being able to get connected to what's the most helpful thing for you tends to be the biggest challenge. So I'd say a university is a great place to start, or a college or whatever it may be, because even if they don't offer something, they very well will probably know of a clinic or a provider who does. Aside from that, one of my go-tos for folks is Psychology Today, the website, because you can literally just click, like filter through, right? I want this type of therapy for this type of issue that I'm dealing with. I have this type of insurance, and also like filter by different types of identities. So it can be really helpful just to kind of have a list of folks that do meet that criteria rather than just calling a bunch of numbers and just, crossing your fingers, hoping that they offer the things you're looking for. I'd also say encourage folks that finding a therapist can be a lot like dating in the sense that it's not always going to be the best fit from the get-go. And there very well could be a chance that like it takes a couple times to find the right fit. And I really hope that I want to encourage folks that that's normal, because it can be a really discouraging experience if they feel like, okay, I finally reached out for help and it wasn't what I was hoping for. And it can be really easy for people to internalize that. But I would say often takes more than one time. And yeah, just kind of getting an idea from people around you through your school of what have you heard about that might be helpful for this thing that I'm struggling with, and taking it from there.
Wow. Yeah. Thanks for that. That's a lot of great resources. Psychology Today, totally a huge thing to certainly use to put in your pocket, so to speak, because you truly can filter through a number of different, things that you might be looking for to specify and hone in on what it is that you might need. And certainly, being able to have access to mental health support on campus is a huge benefit. It's something that we definitely encourage students to take advantage of. When you're outside of school, a lot of times it's much more difficult to access some of those resources versus when they're really offered right there on your campus. So I would encourage folks, if you're feeling a little down or depressed, or you've got anxiety or maybe some other issues, no matter what it is, definitely go talk to someone and try to seek help for whatever that issue might be. With that being said, there are also national mental health resources. And I'd like to go to our next slide just so we can kind of tie it all together, because, there's a crisis text line, which is a 24/7 text-based crisis support service that connects individuals that are in crisis with trained counselors. And that text is, you can text HOME to 741-741. There is also Mental Health America. And Mental Health America offers screening tools, educational resources, and a helpline for individuals seeking support. There you can connect with them at 1-800-273-TALK. That's 1-800-273-8255. And we've also got 7 Cups, which is a resource for folks who might just need to talk to someone. With 7 Cups, they have trained volunteer listeners that are available 24/7 to just give emotional support over the, online chat, as well as other types of support. And it's completely anonymous and completely free. So you can connect with them at 7cups.com. So with that, I just want to say thank you to everyone for such a wonderful discussion. Thank you, Nick, for just being here and shedding some insight into what's happening on your campus, as well as you, Joel. I always appreciate your insight. Appreciate you too, Monica. Thank you so much for talking to us about what's going on at UCLA. And I appreciate you too, Keyshawn, for giving us some of that insider perspective at Sac State. Also want to give a huge thank you to you, Allie, for always coming with that clinical analysis and the scientific analysis to tie it all together. So I really appreciate you for that. I also want to thank our audience for joining us in our Into the Classroom session, which is a production of Mental Health California. Please be sure to visit us at mentalhealthca.org. And if you'd like to access health and mental wellness topics for boys and men of color, please visit our signature initiative at brotherbewell.com. And while you're there, be sure to subscribe to our blog. I also want to give a huge thank you to our sponsor, Blue Shield of California's Blue Sky Initiative, which promotes access to mental health support. You can learn all about their program at bluesky.blueshieldca.com. I'm your host, Conrad Crump, aka Coach Crump. And with that, until next time, take good care of yourselves.